prevention is not random. It must be intentional, it must be purposeful, and it must be strategic.
Welcome to the Mid-America PTTC podcast, where we are a community of change leaders and prevention catalysts that strive to empower individuals and communities to promote safe, healthy, and drug-free communities across our region. We're honored to have you as a member of our PTTC community. Thanks for listening and keep up the great work.
Every single one of us is a leader and could be a leader.
It started with a local coalition in our county.
Strategies you know, but stories you don't.
Data is the currency of prevention.
We want to reduce the negative and we want to promote the positive.
Collaboration is the only way to move the prevention needle.
About connecting the research with the practitioner.
Put something out there that was kind of off the wall and create a community of prevention.
It's a passion, it's a real love to try to help make our world a little bit better, a little bit happier, small pieces at a time.
It's said an overnight success takes 16 years.
If we didn't plan for the change, but if we didn't help orchestrate it, then change is going to be upon us.
When it comes to the spiff, slow is smooth, and smooth is fast. Because the real power is in the process.
Ultimately, all of us want success in the work we're doing. We don't want to do mindless work. Proactive, participatory planning promotes positive, preventive progress.
This is the Mid-America PTTC podcast. I'm your host, Dave Clausen, and I'm the director of the Mid-America Prevention Technology Transfer Center. This is episode 26, and today we'll be talking with Rich Lucy from the Drug Enforcement Administration's Community Outreach and Prevention Support Section. Rich is a Senior Prevention Program Manager in the Drug Enforcement Administration's Community Outreach and Prevention Support Section. Rich plans and executes educational and public information programs, evaluates program goals and outcomes, and serves as an advisor to the section chief and other DEA officials on drug abuse prevention and education programs. Rich formerly served as a special assistant to the director for the Center of Substance Abuse Prevention. He advised the director on policies and program design to support drug abuse prevention on a national basis, and advised the director on the center's efforts to prevent substance abuse and promote mental health among college students. Rich also worked as an education program specialist in the U.S. Department of Education's Office of Safe and Drug-Free Schools. As the team leader for higher education initiatives, he communicated the principles around evidence-based drug abuse and violence prevention strategies in higher education. On today's episode, we'll be talking about the DEA's Campus Drug Prevention website and their newest publication, Prevention with Purpose, a strategic planning guide for preventing drug misuse among college students. This new guide provides a roadmap for college and university-based prevention professionals to address campus-wide drug misuse issues. Before we get into the content, though, we'd like to thank our funder, the Substance Abuse and Mental Health Services Administration. And a quick note, although funded by SAMHSA, the content of this recording does not necessarily reflect the views of SAMHSA. Without further ado, let's get into today's episode. Okay, I would like to welcome Rich Lucy to the podcast. Rich, thanks for joining us.
Hi, Dave. It's a real pleasure to be here. Thanks for inviting us to be part of this.
Oh, we are thrilled and honored to have you. For the folks in our region that might not be familiar with you and campus drug prevention, could you share a little bit about both your personal prevention background and then tell us a little bit about what is campusdrugprevention.gov?
Sure. Well, I've been in the prevention business, so to speak, for my entire career, now going on 29 years. So I started my career in about 1991 in my native state of New York, working for the New York State Office of Alcoholism and Substance Abuse Services. There, for 8 years, I oversaw the state's efforts to prevent alcohol and drug abuse among college students. And then an opportunity presented itself in the fall of 1999 for me to pick up everything and move to Washington, D.C. and start a federal career, which I did with the U.S. Department of Education in their Office of Safe and Drug-Free Schools. And that's where I ultimately became the team leader for their higher education initiatives. I was there for 9 years. And then my former boss, Fran Harding, who I worked for in New York State, was appointed the director of the Center for Substance Abuse Prevention at SAMHSA. And she called me up and said, Rich, I'd really like you to come along and be my special assistant. And I jumped at that opportunity. So I was Fran's special assistant at CSAP for about 8 years. And then DEA came a-calling in 2016 and recruited me to come work in the community outreach and prevention support section for two reasons. One, to build up its prevention capacity and its expertise in that area. And then also to lead DEA's efforts specifically in preventing drug misuse among college students. So that's how I've landed where I have here. So it's a winding road. Not many of us in prevention take a straight path, but it's great where I've landed, and I think I feel really good about the different types of resources that we are offering colleges and universities as well as their surrounding communities, and I look forward to talking a little bit more about them. You asked about campusdrugprevention.gov. And, when I first got here and I was basically given a little bit of carte blanche to put everything on the table in terms of the types of resources that we might be able to offer the field, for me, the important first step was to have conversations with individuals from around the country who are actually doing the work on campus and in their communities. And Dave, you were one of those people that we had those conversations with. And the one thing that we consistently heard, every person we talked to, top of mind, was the need for an online presence that could essentially serve as a one-stop shop for the professionals who are working to prevent drug misuse among college students. And so in the span of about 6 months, from January 2017 until June 2017, in about that 6-month period, we designed the site, we compiled and created the resources, we solicited feedback from the campus reps as well as our federal partners, and then we launched the website in July of 2017. And when I say we, I mean a team of folks here at DEA, but I do have to give a special shout out to our web team, Hortense Barber and Nicholas Rockhour. Hortense is our web content manager. Nicholas does the web design. Their expertise in web design and content management is excellent. And I think they are a significant reason why the website has been so well received in the field.
It is a sharp looking website. It really is. So definitely, I'll second that shout out to those two folks. Great work. Great work. It started in 2017 and it has quickly grown to be that one-stop shop for folks working to prevent drug misuse on college campuses. What are some of the things the website has to be that one-stop shop?
Yeah, so that took a lot of thought on our part because we didn't want it to be just a hodgepodge of a whole bunch of resources thrown together on a website. We really needed to be strategic, and there's a word that will come up throughout the interview, I'm guessing, about which sections would be most beneficial to the visitors and where could they quickly find what they're looking for. So when you visit the website, the thing you'll see across the top of the page is a banner, and some of the major sections are research, where we post the most recent studies, national studies, like the National College Health Assessment, the Monitoring the Future study, the National Survey on Drug Use and Health. 3 major, reliable, valid surveys that a lot of people look at for national data. We also post current journal articles there. As you know, peer-reviewed journal articles are very important in our field as people want to learn about what's happening with a particular strategy or in a particular setting. One of the more popular sections of the website, which is something I was adamant about including on the website, is the drug schedules and penalties page. Consistently, it's showing up, if not the number one page month to month, but it's showing up in the top 3. And I knew that it would be a popular page because we know that folks on college campuses need that information as part of their requirements to the U.S. Department of Education regulations for them to disseminate their policy each year and do their biennial review of their programs every 2 years. And that information is typically included in those policies and programs. And sure enough, people visit that page often. So I'm really happy about that. Some of the other sections we have on there, we have an events calendar if you're trying to find out about statewide or national conferences that are going on, specifically related to prevention, as well as prevention of drug misuse among college students. There's also an opportunity for you to solicit to us an event that you might be working on or know of that would be relevant for the site for us to post, and we'd be happy to do that. We have an interactive map on the website, so now people can click on their state and get 3 points of contact. They can learn who's their local DEA rep to get in touch with. They can identify who's their representative to the National Prevention Network in their state. And if their state has a statewide effort to prevent drug misuse among college students, they can find out who's the point of contact for that. So we're happy about the interactive map. There's a heavy lift to that in some regards, which is trying to keep it as up to date as possible. So we try to do that on a somewhat quarterly to semi-annually each year, making sure it's current. Some of the other major sections, we have our views in the field. Those are guest articles written by folks at the federal, national, state, and local level each month. And our own podcast series, Prevention Profiles Take 5. You've been on that podcast series. We were happy to have you there. And that's a monthly podcast that I get to host, talking with leaders at the federal, national, state, and local level, talking about current and emerging issues that are affecting and having an impact on drug misuse prevention on college campuses. The last things I want to mention are more recent sections that we are very proud of that we posted on the site this past summer is the Practitioners Toolbox. And we specifically created that as a resource to help make the prevention professionals' job a bit easier on campus. So we've included some sample campus policies related to alcohol and other drugs, not there to mimic. And but in prevention, we do beg, borrow, and steal from each other. This is a way for people to learn what other campuses are doing with their policies and how maybe they could adopt something similar on their campus. We also post sample biennial reviews, which is really helpful for campuses. And this year, being an even-numbered year, is a typical year that campuses are taking a look at their prevention efforts for effectiveness. And so we've put some sample policies online for people to get some ideas from. And then lastly is the Student Center. The website is primarily intended for the prevention professional, but we found a need last spring to offer the opportunity to provide a small section of the website to be student focused. And so that's why we created the Student Center, which is some student focused content specifically on preventing marijuana use, prescription drug misuse. There's a document on there on how to help a friend if you suspect that they might be struggling with a drug problem. And then lastly, the peer education portal, which is our newest section, launched just this past January, where peer education groups from around the country can submit programming ideas that they're doing on campus so that others from around the country can learn from their efforts. And so we're excited about that new section that we've put online. So it's a lot to get through, but the site has, I think, something in it for everyone. Even though we try hard, it's hard to resist being all things to all people, but it's a lot that we've tried to organize in an easy way for people to find the information they need to help do their jobs better and more effectively.
Excellent stuff. It really is that one-stop shop from current data to drug scheduling all the way down to the Practitioners Toolbox and student resources. I love it. I love it. And I got a hats off to the entire campus drug prevention team, because you all are showing how responsive and innovative you can be. You're listening to the field, what their needs are, and you're going out and making it happen to serve us. So thank you all. Great stuff.
You're welcome. If it's one thing I've learned actually here at DEA in the almost 4 years I've been here, is there is truly a can-do attitude about, whether it's the agents, to the chemists, to the diversion investigators, to the professional staff such as myself. They see a need, and we try to quickly find a way to address the need.
I think a lot of that just shines a light right onto your passion and caring. Excellent stuff. So as I look to the left on my desk, I've got this nice new guide that's titled Prevention with a Purpose, a strategic planning guide for preventing drug misuse among college students. What do you know about that document?
So thank you for referencing it. We created it for the same reasons we created the website. It was really not unlike the reasoning behind campusdrugprevention.gov. We wanted to fill a gap. And so when we talked with the campus-based professionals from around the country, they told us that they really needed some current publications and guidance documents to support them in their work. I've been in this field, like I said, for 29 years. I've been at the federal level for 20 this past fall. And sadly, the federal landscape of providing current resources for this field, this segment of the prevention field, is woefully behind. We have not had any really good updated materials for the field in more than 7 or 8, 9 years. And that's, it's really a shame, because when you look at the 18 to 25 age group, which a traditional college student falls squarely in, that is the age group where we're seeing our highest rates of drug use, whether it's marijuana, heroin, prescription drug misuse, what have you. And so as I started thinking about what DEA might be able to offer in this area, I kept coming back to the Strategic Prevention Framework, or the SPIF. And so, the SPIF has been around for about 25 years. So that's not new. But what did not exist was a publication that specifically tied the SPIF to prevention efforts on college campuses and in their surrounding communities. So we hired a contractor with extensive experience and background and knowledge in this area, and we produced a publication that we launched this past January that ended up being, I'll say wholeheartedly, one of the things I am most proud of in my career.
Oh, I love it. It really is a comprehensive planning guide. And I'm a big fan of the title, Prevention with a Purpose. That resonates with me. It does. So how do you envision a campus professional using this guide?
Well, plain and simple, it's a roadmap. It's not intended to dictate to people what they should do. And we would never take that position, because we know every campus is different. Every community is different. We know that in prevention, it is not a cookie cutter process. So what happens at ABC University may or may not work at XYZ college. But it does serve as a how-to guide, if you will, for how to measure the scope of drug issues on your campus, how to build relationships with key stakeholders, how to develop a strategic plan for prevention efforts. It is intended to be a guide for readers to look at and figure out the best process for them to answer 5 basic questions. Now, these are not easy processes, but the questions themselves are quite basic. 1, what's the drug problem that I'm working to address? 2, what do I have to work with? 3, what should I do and how should I do it? 4, how do I put my plan into action? And then 5, is my plan succeeding? That's the SPIF in a nutshell. And so we've organized this guide in 8 easy-to-read chapters with helpful graphics. It was one of my mandates to our contractor. We wanted a visually appealing document that I don't want to say it doesn't sit on the shelf. That happens at times. But I wanted it to be a really useful desk reference. And then we've been hearing from people just in the several weeks that it's been released that it is doing just that. So we have our print version that we make available, but we also have an online version of the guide that is about 70 pages longer than the print version, because the online version has an entire comprehensive series of tips and tools and worksheets that people on campus can use related to every step of the SPIF. So if you need help on building capacity and building relationships with campus and community stakeholders, we provide you with some helpful tools on the various levels of collaboration and what that means. And if you need help with surveys and needs assessment, we give you some ideas for that. How to conduct a focus group, how to develop an elevator pitch if you're learning how to communicate the work that you're doing on campus for a variety of audiences. We do that. We have a nice template in the online version for a logic model, which, for some people that may want to give them reason to run screaming from the room because it looks daunting. But, people have to put in the work. And a logic model really is only as difficult as you make it, is the way I look at it. It is essentially saying, back to those 5 questions, what's our issue on campus? Do we have the capacity, and what are our gaps to address it? What's the plan? How do we implement it? And then ultimately, how do we evaluate it? So hopefully that's what we've created with the guide. And based on early returns, it looks like we've hit the nail on the head with this, and I'm really happy about it.
I am a fan of the planning guide, Prevention with a Purpose, and I love how it is built on the strategic prevention framework. And a quick shout out for folks listening. We are getting ready to launch our PFS Academy 2020. Making the steps of the strategic prevention framework work for you. It's a 7-part virtual academy where you dive deep into each step of the SPIF, and it's free and available on our website. And I'll put the link in the show notes. All right, just had to do a little pause for that shout out. Getting back to strategic planning, what would be one piece of strategic planning advice you'd like to share with a campus prevention professional?
So my primary message on this area is, it's going to come across as a soundbite, and maybe that's intentional because I try to compartmentalize these into easy to remember things. But my mantra over the last several years in presentations and speeches that I've been giving on this area is that prevention is not random. It must be intentional, it must be purposeful, and it must be strategic. So that's the beauty of the SPIF. So it doesn't matter if you're dealing with alcohol, marijuana, cocaine, meth, more than 3 decades of prevention science tell us that following a strategic approach is the key to an effective prevention program. So I don't really much care if you're using the SPIF per se and its 5 steps, but you really do need to be following some form of a strategic planning process. And if you don't, then you shouldn't be surprised if you don't get the results that you're looking for. This is, you have to do your homework in prevention, and there is a lift involved in knowing your craft and knowing your science. But, here's a little bit of a Cliff's Note version for you with the soundbite, which is at the very least, have your strategic plan in place.
That is an excellent bit of advice. And thanks for the soundbite. I might have to include that in our podcast introduction so it can live on for eternity.
Hashtag prevention is not random.
Exactly.
And it goes with our hashtag now, prevention with purpose. So that's, actually, all kidding aside, it's a little bit about the title. We struggled with the title of the guide. We didn't want it to look like your typical, dry government type of document or publication. And we kept coming back to what is the crux of the guide. And it really came down to the fact that, the work we do has to have purpose. And so that's how we ended up with Prevention with Purpose.
I love it. I do. Well, as we move towards the end of this episode, I always like to invite our guests to share an upcoming event, a training, a resource they want to highlight, or even share a call to action to the field. So what do you got for us?
So, there's a couple of things I definitely want to mention from the DEA side. National Prescription Drug Take Back Day is coming up again, April 25th, and that's 10 a.m. to 2 p.m. And we we've been trying to have a concerted effort over the last several years with our partners at IACLEA, the International Association of Campus Law Enforcement Administrators, a group that I know you're familiar with, and getting their help along with NASPA's help to encourage colleges and universities to serve as a collection site if they so choose and like to do so. We can put people in touch with their state's coordinator from our side, but it really is incumbent upon the college or university to work with their either uniformed police force on campus or their municipal police, because you do have to have law enforcement involved and staffing the collection site. We've been happy with the over 100, between 100 and 200 campuses over the last several years, each Take Back Day are serving as collection sites. I think we can do better, but I think that that's a good start considering a concerted push that we've been having over the last 3 years. So Take Back Day, I definitely want to bring up. And then the other thing is we're going through a significant renovation of both of our buildings here at DEA headquarters. And so that includes our DEA museum, which is currently closed. It's been closed since last fall. It will have a grand reopening in the fall of 2020, so later this year. And if you're in the DC area and you're looking to check out a really innovative and really cool place to check out DEA type artifacts and information about drugs through history, this would be the place to go, and it's free of charge. And so I definitely encourage your listeners to put that on their to-do list if they're either in town in DC on business or pleasure to come check us out. So those are two things top of mind. There are other things. Check out our events calendar. Like I said, there are on campusdrugprevention.gov. I'm fortunate in that I get invited to come speak at, like I said, national and statewide conferences, and the docket is starting to fill up for later this year. I actually think I'm coming to your region in April for the Meeting of the Minds conference. And so that's exciting. And it's more just continues us promoting our resources for people and getting the information that we've heard they need out to them. So those are just a few of the things I want to put on people's radar screen.
And I will be at Meeting of the Minds as well. Looking forward to seeing you there. And yes, the DEA Museum, so much history there. I would echo, if you're in the DC area this fall, stop by for that grand opening. Now, in the show notes for today's episode, I'll put a link to campusdrugprevention.gov and Take Back Day. Are there any other ways listeners can get connected with you, like an email list or social media or anything along those lines?
Absolutely. So first of all, on campusdrugprevention.gov, there is an email. There's a way to sign up for email updates. You will either see an overlay on the site if you're visiting it for the first time or from a different computer, or there's a sign-up box toward the bottom of the homepage, and we send out weekly updates on new content that's been posted to the website. And in just about, it'll be 3 years that we've launched the site this July, we currently have over 71,000 subscribers to the website. So it has grown in leaps and bounds in terms of the number of people who stay connected to the website. So that's true of all of our different websites, not just the campusdrugprevention.gov site, but we have justthinktwice.com for teens, and we have getsmartaboutdrugs.com for parents and other caregivers, as well as educators. And so there are ways to subscribe to those websites as well. You mentioned social media. So our social media platforms have really blossomed over the last few years. For the longest time, we were active solely on Twitter, but we now have our Facebook account, our Instagram account, and we are on LinkedIn. So if you're on Twitter, Facebook, or Instagram, you can check us out by going to @DEAHQ. And if you're on LinkedIn, simply look us up by our full name, Drug Enforcement Administration, and that'll take you to our formal LinkedIn page. So social media platforms and email lists is definitely a way to stay connected with us.
Excellent. And the show notes will be full of links to all of those. And just a little shout out. Thank you all there at your team for being so responsive and serving the prevention field the way you do. You hear and listen, identify a need, and you get to work to make things happen. So to you and your team, thank you very much.
We appreciate that sentiment, Dave.
And it's been a pleasure having you on today's podcast, and look forward to seeing you at Meeting of the Minds. Thank you very much for taking time out of your schedule to come chat with us.
Same here, Dave. We appreciate it, and thanks for the work you're doing to get the word out.
That concludes this episode. Thank you all for not only taking time to listen, but for your continued work making our community safe, healthy, and drug-free. If you'd like to know what trainings we have coming up, check out our website at pttcnetwork.org. There you can subscribe to our monthly newsletter and get the latest, greatest delivered right to your inbox each month. And remember, prevention is better together. And together, we are stronger. Thanks for listening, and we'll catch you on the next episode.